I've got some very interesting panellists up here with me on the Dr. Phil couch, and also one online, maybe starting with online. A warm welcome to Henia Dakkak, who is the Head of Policy for Humanitarian at UNFPA, also a medical doctor, casual and public health specialist with a lot of experience working in humanitarian settings on sexual and reproductive health. Also Richard Lace, who I think if Alex is a relic, I'm not sure what Richard and I are, maybe antiques in the CDAC space. Richard's been around in this conversation for a while, is the Director of Programs for BBC Media Action now, following a lot of experience in the area, including recently as Country Director for BBC in Bangladesh. And next to me I have Annika Sjoberg, who is the Senior CBI, is another acronym, Cash Officer with UNHCR, leading UNHCR's cash policies, and she comes with a protection and program background. So a wealth of experience here. I think if we sort of frame this discussion around, you know, we had this whole discussion about has accountability taken over this conversation from communication, etc. I think it's become very clear in a lot of the other discussions that without communication, you can't have participation and you can't have these revolutionary changes that we're really hoping to see. So maybe getting back to basics a little bit, I'll start with Richard. You've obviously been working on the intersection of media development and rights in humanitarian settings for a really long time, and that has implications well beyond, I suppose, the programs that you've been working on. What impacts have you seen in investing in work like you're doing on communication and community engagement? And how can that sort of help to bridge some of these divides between humanitarians and other international, local, etc.?
I'll try not to pick every example this afternoon from Bangladesh, but let me start with an example from Bangladesh. It's the space that I know best. And particularly a rights-focused intervention that we ran there. I think Banner's just finished. And I guess some surprises came out of that. I mean, I think the fundamental problem that we may get on to talk about this afternoon is that the right to information, which is enshrined in everything we believe, we're still not getting that right. There's often a gaping hole that means that people are not able to access the information that they need to help them make good decisions and to help them keep safe. And so for media practitioners in the room, the example I give may be sort of feel a bit pedestrian, but I think let's get back to what we know works, which is a really strong evidence-led piece of work in Bangladesh, in Cox's Bazar, with the Rohingya refugee community, supporting them in particular to understand rights and entitlements in their life. Working very simply through a range of different community leaders in the camps, supporting those community leaders to have conversations, sometimes augmented with media content, but not always, about rights and entitlements for refugees. And I mean, so far so obvious. Some of the things we found also maybe not particularly surprising. You know, people really worried about registration, people really worried about how to access education in particular. But some of the things much more surprising. One of the things that really shocked me was a huge demand for information about the rights of prisoners, partly because the authorities in Cox's Bazar had started arresting people for moving between camps once the fences went up. So big demand around people who wanted to know what their rights were if one of their family got arrested, who they could visit, how often they could visit, all those sorts of things. That was a new one for us. I guess also some surprises around the intersection of different rights. So we found very quickly offsetting the idea of people's desire to understand their rights in terms of education for their children was that actually once that had happened, it wasn't getting used. And the reason turns out that without other rights, without the right to earn a living, without the right to start a business, without the right to have a job, without all those sorts of things, what point is education? So actually, half the room has worked in Bangladesh. You will know that the upticks in gender-based violence, upticks in girls being pulled out of school and out of learning centres, real issues. But the thing that I think in that particular example really we struggled with the most was how to get that conversation we were having about rights with the community into the policy space. And I think at its best, the media and the work that people like us do can be a really, really helpful mediator of that conversation. I think we struggled in that case. And I think one of the reasons we struggled was the, I guess, unexpected blowback that people were getting for even thinking to speak out about some of this stuff. I mean, there's risk of death, there have been murders of people who have been talking openly about repatriation of Rohingya people in Cox's. And so we're still, and talk to Banner, here's much more across what we're doing today about it, but we're still looking for ways to really make sure that the conversation that we're able to have and we're able to facilitate at community level is really properly heard and understood in the policy space, in places where decisions are being made. And I think that's often a role that the media can play, which we don't necessarily think about. In that case, it's a role we're still navigating and trying to work out how to do it in a safe and effective way. Not sure that answered anything about what you asked me, but
no, it answered a lot. Thank you. And I think it touches on something that came up a lot this morning, which is when you really properly listen to communities and engage them about things that they want to talk about or that they're passionate about, they often don't fit neatly into these humanitarian silos. And I think that's a real challenge for us, the more that we try and advocate for bringing this into various humanitarian settings. I mean, it sort of is a nice segue into cash, because I feel like a lot of the cash debates are about, when you do provide cash to someone as a modality of aid, you are letting go of a lot of the control on how cash should be used, etc. Conversely to that, there is this implied idea that by providing cash, we're empowering everyone, and that, suddenly all of the issues that underpin humanitarian assistance might magically go away. And a lot of the work that we've done at Ground Truth has told us that that is certainly not the case. So I'm quite interested in, as a practitioner and a policymaker on cash, UNHCR and you personally have put a lot of effort into sort of engaging communities, making sure that people are heard, putting various strategies in place for that. What have you learnt from that process about some of these linkages between communication and empowerment?
Yeah, thank you very much. First of all, as a cash champion, I guess I should say that I truly believe that cash is an enabler for communication. And what I mean with that is that we wouldn't have spoken to many, many millions of people unless we were giving them cash. And we wouldn't have known that they had mental health issues or protection issues, or they wouldn't know where to go to seek healthcare if we were not giving them cash, because they will hear about cash and they would know and they will come, right? It's different from call this number and you will get information. Here you will get something substantial. People will come. And it's really an entry point. We saw it in the Ukraine crisis. People came in the surrounding countries getting cash, but in the end, 50, 60,000 in Poland have, had protection services, for example. So I think, first of all, it is an enabler for communication. Do we do it well? No. What we have learned, I mean, we have been on many, many, many field trips. And in terms of looking from the cash perspective, I mean, I have seen in many camps, refugees walking around with a plastic bag, with a mobile phone, with a PIN code, and they don't know what to do with it. And that's in a camp where we have boots on the ground and we can actually talk to people and show them. And it's not in some urban place where it's much more difficult to talk to people. So it is very, very, very hard. We also have seen, refugees, you come to a country, you get the card, you enroll with some agency, you may not know who they are. maybe you don't know how to use the card. You get mobile money, but you actually haven't used mobile money before, so you didn't really know how to work it out. So I think you may have to pay somebody to actually cash out your cash. I mean, we have seen all these sort of examples. So what do we do about it? I was advised by our AAP expert here to say we have to do it before. No, but she's very right. I mean, in many cases where we do these in-depth focus group examples, discussions with women, for example, I was in Niger, before setting up the cash program, I asked them, do you want to receive the cash or do you want your husband to receive the cash? The Nigerian women said, we want the cash. And the Malian women said, no, wait, don't give it to us. It will imply a lot of risks. And if we haven't done that sort of communication before the cash, it would have had really bad implications, right? So I think we are moving a lot to digital communication. We have all sorts of digital cash apps, digital stuff. It's all good, but in many, many settings, people are maybe not digital. And we know that literacy is weak. So I think still, the boots on the ground, talking to people, we do a lot as UNHCR, and they come to us, and we know it. We just don't log everything, but they know where to come. But it's much more harder. I was in Poland setting up the cash response there for the Ukrainian refugees. They have to come to community center. They have to register with us. We invested millions of dollars in time in training staff, in communicating with people. This is where you go for this. If you have a problem, call this number, come back to us, do this. I mean, they were trained, and it was sort of a perfect setup in my mind. Then I see in the post-distribution monitoring data that 40% of the people didn't know where to go if they wanted to complain. How is that possible? What did we do wrong? And this is where we will talk to Ground Truth Solutions in finding that out. Yeah, maybe I just stopped there. It was just some. Yeah.
No, thank you so much. And I think that also, I mean, it definitely resonates with us at GTS. We have so many conversations with people who are doing everything right. And then we talk to communities and it just doesn't meet up somehow. So there is a lot more sort of engagement that needs to happen to understand why some of these things aren't working. The UNHCR AAP expert is here in the room. If anyone else would like any advice, she's here all day. I'm going to go now to Henia online. I'm not sure how to look at her, but she, as an expert in reproductive health, I'm sort of interested in this area which has so much implication for things like behaviour change communication. And a lot of the discussion that we've had in this forum and other ones has been about how you can't sort of talk at people when it comes to community engagement. And I think some of the examples that you've just raised sort of touched on that as well. And I'm wondering, Henia, how have you sort of been able to go broader than that behaviour change communication type work? And what impacts have you seen by doing that?
Thank you. Do you hear me well? Excellent. Just to make sure that you are hearing me. In terms of, behavior change and communication and sexual and reproductive health is really a broad area. And I think in the sexual and reproductive health, we know it's important to have the information for people. Otherwise, it's going to be very difficult for them to really access services, especially in humanitarian setting. It's not enough, that you have the services or you have the supplies that you need for your services, because if you don't have supplies, you don't have a service. But it's important. As much as we are talking about supplies and services, it's very important that information is provided for people. And I give you an example. Recently, I was deployed to Moldova to support also with the Ukrainian response, similar to my colleague in UNHCR. One of the issues is while you put the services available and make the services available, people still didn't know where to go and how to access the services. It's difficult because people are moving from one place to another. In order for them to understand where the services are is not intuitive. It has to be provided, and it has to be provided in a way that is not top down to people, but, really according to what medium information that we need to provide. We were providing them with support. We were making sure that the insurance companies, are able, like the National Insurance Company is covering, all the sexual and reproductive health services. Still, people were not, utilizing these services because they didn't know where to go. And that's why one of the things that where we found that communication is really key in order for us to really address the life-saving aspects and really making sure that they get the information when they are registering. Also, that's the issue of coordination, where you need to coordinate with all the different players. And even when there was a group that worked on accountability to affected population, and one of the issues that came out also from some of the studies and research that was done to really understand the community better and provide them with the information in their own language that they understand. And it's not always that we assume that they would understand the language we are talking. I think it's very important in the communication, especially when we are talking about sexual and reproductive health, is really to understand where the community is and at what level, and make sure that the information is given in the local language, in the way that they will understand, in the different mediums. For example, young people wanted, things on app, and they wanted to know where to access internet. And so you have to really work with them to understand where the information that they need will come from. So it's not only that you utilize one medium, or it is one solution, or it's one size fits all. I think you really need to make sure, from my experience, is that you really spread the information wide and make the population itself as part of the solution, because they communicate among themselves. And it's very important that we also make sure that within the community itself, there are communicators within the community that spread the word, and that the information is correct that they have, so that then they will utilize that. So we utilize safe spaces, for example, to really bring the community in and work with them, understand first their needs, and then make sure that the information is available. So it's not that you always have the information and the services and information should be available everywhere, but I think you also need to involve the community and have the community participate in really understanding what are their needs in terms of communication, in terms of language, in terms of the messages that you need to provide to the community. And sexual and reproductive health is really, sometimes the elephant in the room. The needs are always there. People don't think that sexual behaviors or sexuality stops because you are in an emergency or you are in a humanitarian setting, then nothing will be happening. Actually, it's very important issue for many people, and it's vital. And therefore, you cannot always say, okay, they should know. No, they cannot know unless you understand first what they are going through. And one of the things that we found when we were working to address gender-based violence, for example, that transport, when we were talking with the community, the transport where a lot of harassment was happening. Public transport, where a lot of the community was complaining. So it's very important to really make the community the center of your understanding first, and they have to tell you what's going on in their community and what would be helpful for them. Otherwise, we are just giving things top down, which is not always the issue, and we need to work on service providers. Service providers also need to be educated, not in the sense of, trained and educated on how to communicate. And sometimes in health service providers are the worst, okay? I'm a medical doctor. I can tell you, sometimes we are the worst people in communicating about, understanding and communicating better with the patients and with the women and children and the different community that comes to the health provisions. It's very important that they communicate in the way that makes sense and that goes beyond, I go back to my colleague who was saying, in the beginning, it's about their rights. They have the right to the information, and they have the right to reproductive health services and information. That was something that we always knew, that without communication, sexual and reproductive health issues will not change unless, we communicate, and we communicate better what are the behaviors that would really protect people on the long run. So I'll stop here, and I'm happy to answer additional questions as we go along. Thank you.
Thank you so much. A lot of very rich content in there. And I think also this idea of, there are a lot of examples in there about listening before you kind of design an approach. Also a very important lesson that we shouldn't deploy doctors if we want communication to happen properly. But I think so far it's been quite interesting because it's all sounding very nice, and there's a lot of great examples of what we're trying to do and why it's important. But obviously there are a lot of reasons why this doesn't work. And I think you touched on one of them before, so I'm going to hand back over to you, Annika, not to put you on the spot. But I think there's, we've had a long conversation today about how donors sometimes are maybe perceived as a barrier. Another one that Ground Truth often blames is big organizations, and particularly UN organizations. But I think sometimes, you try and do all of these things. So as you said, you're doing everything right, and you are engaging people, and at some point everyone gets a bit frustrated because it hits a certain ceiling and it doesn't have the impact that you want it to. And I'm sort of wondering, based on your experience of being in those roles, why is it that you put so much energy into communication and maybe it doesn't always have the impact that we want to see? Like, what are some of the bigger systemic issues that you've seen or that you're facing? And if you were given a magic wand, how would you sort of make those go away? Or what changes would you want to see to enable this work to be more meaningful?
Okay, first of all, I want to just make a point. I work here in Geneva. I live in France. I'm about to construct a house and I'm trying to get a loan. It has and I speak fluent French, but it has taken me, 10 months to get this loan. I'm just trying to put the perspective of, it's not that easy all the time to get the information. I get the information. It's just, I don't understand. I understand what it is, but they meant something else that I didn't get. So I think it's a good example that we don't always, and nobody is like monitoring how I am perceived or what I understood, right? So I think we are sort of always looking into this very particular. Maybe I'm a devil's advocate. On cash, I think we have done really great things sometimes. We have the PIN code. We don't have the number. We had pictures. We have animators. We have radios. We have all of this stuff that you guys are working on in place most of the time. What I think often works is to learn from the governments. The governments have good communication in general, right? And the population seems to understand that. And even if you look at, for example, the Swedish Migration Board, they have excellent communication to refugees. They translate everything. It's clear. People actually understand it. So I think as a UN agency, we have a lot to learn from host governments and just governments in general. And maybe not just, go down to the, root basis. It's good. And that's what we do with our animators and videos and visual stuff. And working through local organizations, of course, which is key. But I also think in general, we have a lot to learn from those bigger organizations. We have also worked in terms of partnerships. I think it's an aspect. we try to work together with our partners because we say different things and we give different things and we give different cards and people get confused. So coordinating all of this in terms of the communication, of course, we need to do better, but we have some good practices where we actually have come together in some of the countries. And I think it works well. And you can really show that it's much clearer than getting like 15 different messages from different organizations. So that one I think is also very key. We have worked in partnerships with the financial service providers. So for example, we worked together with WFP and we put in place a code of conduct for financial service providers where we actually train them on communicating, because often it's not us handing out the cash, right? It will be Orange or some bank or something like this. And they are not used to dealing with people perhaps that are dependent on them. They may be more used to people who are choosing to come to them. Here's just somebody that we say, you will give money to these people. And we have seen a lot of discrimination. So I think working in partnership and working this together, including with the private sector and with the financial service provider, has proven to be quite efficient. So maybe those were some of my examples.
And I think that makes quite clear that you can only communicate so well in a very imperfect world. Like we get a lot of feedback at GTS on cash, on targeting and duration of assistance, and people saying, you know, no one has told us how long we will get this assistance, or we don't necessarily understand, you know, why some people get it, why some people don't. And, you know, and I think maybe Ground Truth of old would have then sort of passed that feedback on very directly and probably quite critical to service providers. But when you actually speak to some of those service providers, they also don't have this information. Like people don't know how much funding they have to implement a program. So it's very difficult then to overpromise to a community in a way that's not going to do more harm than good. And similarly, maybe passing over to Richard when it comes to rights. I mean, it's interesting hearing so much discussion about communicating people's rights, particularly in situations where those rights are sort of maybe actively pushed down. And so I'm just wondering, you know, based on some of your experiences, including your recent experience in Bangladesh, how do you sort of navigate that as a communication actor when there's so much complexity going on around it?
And I'll come to that slightly roundabout, just picking up on some other things. And I think that point about cash and the demand for information that doesn't exist is really important, because I think often we as a sector are embarrassed we're reticent to be open with the audience, and it takes us too long to admit that we don't know the answer. And again, Bangladesh, sorry, but at the beginning of the most recent influx, the huge risks in Cox's Bazar is cyclones. And you now have 1 million odd people there living in things that certainly wouldn't survive a cyclone. And the question, quite obviously from the community, was, you know, they lived 50 miles away and they know that cyclones hit this bit of the world, is what are we going to do if there's a cyclone? What's your plan? And I don't know, Banner, if you remember, or Irene or somebody else, how long did it take the humanitarian community in Cox's Bazar to finally agree that we would be upfront and say, actually, the plan is you stay where you are and hold on tight because there's nothing else. And I think we were in meeting after meeting after meeting debating how, you know, whether or not we should be honest. But the moment that we were, they were like, oh, okay, fine. Now I can do something about that. I know where I stand. I'll go and, you know, maybe actually it'd be good if you could give me a bit of extra rope because I want to tie this thing down. You know, they went with it and they understood. They're not stupid in any way. And so I think that openness when you don't know something is really super important. And then just one of the points that our colleague from UNFPA was talking about, I think the channel that you choose is often really important. And I think we too often run down the route of a good sort of information ecosystem analysis where we would go in and say, okay, we're going to ask people what their preferred mechanism of communication is, and then we're going to go and meet them where they are. Yes, good, excellent, good practice. If we're talking about sexual and reproductive health, our experience is the worst thing you could possibly do is go and do it in a face-to-face meeting with a community leader, right? People want to talk about sexual and reproductive health, but they want to do it in secret on Facebook or listen at midnight on their radio set with their headphones in, because they don't want their mum to know that they're listening or understanding about that sort of topic. No way. And so I think a bit more nuance in when we're selecting the mechanisms and the channels that we're choosing to communicate with people is super important. I've forgotten your question, Meg. Maybe I'm just rambling now.
The question was about rights.
Yeah, I mean, it's all rights, right? It's the right to have access to information and then to be able to look after yourself and your family. It's simple. I guess my core point is, when we sit here and say, oh yeah, we'll do some radio, we'll do some stuff, we'll do some this, we'll do some that. It ain't that simple. And I think sometimes we're in danger of, it's called community engagement, right? It's not called community, let's go and shout at them. So there is an art and a science and evidence, and particularly in the SBCC arena, decades of evidence that tell us what works and what doesn't, that we need to take into account. We need to adapt that to what we know about the local conditions. We need to talk to and listen to people who are there, who've been there before we arrived, who understand the market, the audience, the context. And I think too often communication is treated as an add-on on the side rather than highly specialized technical resource that it needs to be.
Thank you so much. I think also it's, this issue of rights running through everything is actually really important, because if we just reflect on, maybe this was the point of the session and I finally understood it, but a lot of the guidance on AAP, for example, is very perfectionist, and it's very, we need to do this and that, and then this, and then that. And then I think someone made a point this morning about the problem with the word ensure. And I found that also really telling. Like, we need to do this and this and this, and then everything will be perfect, and we will ensure a perfect outcome for people as people with power that we sort of have. And I feel like a lot of the attempts to communicate within the humanitarian system really enforce the role of communities as being passive recipients of something, where maybe they get an opportunity to comment on that thing, or they have information about that aid service. But beyond that, we sort of forget that they're real people with, as Henia said, conversations that are going on between them, and they're rights holders, and, they're sort of approaching UNHCR with certain questions that maybe have nothing to do with the cash program, etc. So I guess it would be interesting for all of us to reflect on this a little bit in light of the previous conversation. Like, when we think about how we apply communication, what does that mean with regard to these bigger revolutionary ideas that we were having, and is there maybe a bit of a disconnect? But maybe just a question for the three panelists, and then I'll see if anyone in the room has thoughts, or maybe if anyone online. I think we are at this sort of quite critical moment in the whole accountability discussion, where it's getting a lot of attention. There's a lot of political will to finally move the needle on some of these issues. And we want to make sure that we're sort of doing enough to push that forward based on these experiences of engaging with people in a way that goes slightly broader than the humanitarian system. What kind of system do you want to see? And does that feel possible, or are there sort of too many hindering factors? And I might start with Henia, just because of your quite rich examples before. What would your perfect system look like a few years from now?
That's that's a complicated question. Thank you for that. But I think what I would love to see, I think, and I go back to Richard point about community engagement. I don't want to see community engagement as an afterthought, I want to see it as, like a directive, more, active approach from the humanitarian community to listen to the community from the beginning and engage with them from the beginning in terms of what type of support they would need and what type of services or information they would require. And I think that's something that we need to build, that trust between the international community or the national community, because let us face it, in humanitarian setting, most probably the international community is going to come later on, not from the beginning. The first responders are the community itself, and or the recipient community. Immediately, they are the ones who are responding, or the governments who are responding immediately to the needs. So the international, let us say, humanitarian community will come later. But I think a part of it is that we need to get that element of engagement and really having the community at the center, and the individuals, of course, the individuals, the community, the families at the center in whatever we are doing in terms of engaging with them. And we have seen, again, the examples, whether it's from different settings, is that the moment you give them the trust and they trust you, then, whatever solutions you will come, they will be more sustainable in terms of the support that you are providing to the community. In the end of the day, we are there to address some of their unique needs. And for example, for us as UNFPA, it's about, how do we mitigate gender-based violence? How do we make sure that, women who needs to deliver can deliver safely? How do we make sure that the young people who need information about sexuality and sexual behaviors, they will get that information in a good, communicated to them in the confidence that they want, without really, interference from sometimes the parents or the community, and really protecting them for the long term. So, or, if they want to have, to have family planning method or spacing their children because they are not in a situation where they want children at this moment, you really need to understand what their issues are, and then, work with them to see how you address that in a manner that is really conducive for their well-being. And again, it's about the rights and really making them at the center. And I wish, that the international community also understand that we don't have all the solutions. The solutions sometimes are within the community, but we need to understand and unpack that and change the narrative, instead of, them as a recipient, but them as an active participants in this whole endeavor, because we are not, alone, and we are not working in vacuum, and we don't always have the solutions. And I agree with my previous colleagues who talked, from Annika to Richard, that we almost, come later in their life and try, to fix things. We cannot fix them unless we listen to them, unless we understand what they are going through, and then, find the solutions that will make sense for them mostly. So I'm a person who basically believe that the community has a lot of the solutions. It just, we need to really communicate better and have a two-way communication in order to really engage them from the first go, instead of just, in the design, or, like, let us, do evaluation or have a complaint mechanism. It's not always that way. There are many elements there, but I just say it's very important to engage them from the beginning. They will know the solution. I'm saying that also as a person who, has been in living through these type of situations almost all my life, so I know that the solutions sometimes are within the community. Over from my side.
Thank you so much. Strong words there, and a lot of them that echoed quite a few of the strong sentiments from yesterday afternoon as well. If there's anything to add to that, maybe from my colleagues here on the couches, what are some of the bigger changes that maybe need to happen for these communication activities to take hold a bit more?
Looking at me, Annika, so I'll go first. Quickly, 3 things probably, at least. I think we need to chuck out the idea of two-way communication. I think it's quite self-centered. I think we need to embrace the chaos and the systems that Henia was just talking about that exist already within communities, and leverage those much more than we are, and not worry about having to control everything. And I think we talk a lot about two-way communication, but then it's all about, did you get the stereotypes or not type, it's functional, and it's, I think, too much about us. I think I'm repeating myself, but I tell you a very quick story, not about Bangladesh, but somewhere else in the world that will remain nameless, and a UN agency that will also remain nameless, who came to us and said, could you pre-test these messages for us? Which is, something that we do. 8 pages of close typed technical nonsense, I swear. It's just like, we think because we all have the sense that we know how to do this, we think that everybody does. It ain't the case. And I'm sure there are people from that UN agency in this room who are very good and do know what they're doing, but it isn't all pervasive. And I think we forget that there is still a pretty gaping hole in many places about getting the basics of communication right. So professionalizing it and recognizing it as a specialism that should be funded is really important. And then the third, which we haven't really talked about so far today, is recognizing that, particularly in my world, the independent media partners that we often rely on in those situations are hit as badly as the communities that they're serving when disasters occur. But whereas for us, and even for some of our local NGO or CSO partners, the funding arrives with the disaster, for independent media, almost all the time, the funding disappears at the time of a disaster because their advertising market vanishes overnight. Often their workforce is completely disrupted. There's all sorts of things that they're battling. And I think recognizing independent local media, and Caroline was saying it much better than me before lunch, recognizing them as a proper, respected humanitarian actor and funding them properly to do that job is also really important.
There'll be a game of Guess the UN Agency on the coffee break. Prize being an obscenely high per diem. I think that's a really interesting point about media, and also one to take away with us, because it really touches on, again, this point about relinquishing control. And I know that as a sector, we're just so not willing to do that. But anyone who is a sort of a prolific actor on accountability in a humanitarian setting is probably not going to be part of this system. And there are so many things that need to happen to make way for those institutions to do what they naturally do, which often is sort of missing from the whole humanitarian conversation. Annika, any final thoughts from you?
Just that I would put my money on a French bank, not a UN agency. No, just to add, I agree with everything and also what was said before. And I think it's not only about sustainability. Of course, we want to see a community-owned system. It's also about security. I mean, we have so many situations in targeting or whatever, where it actually leads to big problems. And we have seen when we invest from the beginning, we discuss with the community who are the most vulnerable in the community, and those are the ones who receive the cash. What is your preferred transfer method? This is it works. It works. I mean, it's really, we have to do that work. A fourth point that I would add also, at least from a UNHCR perspective, is we need to get better on digital communication. 70% of the people we serve live in urban settings, right? And we are not good at that. We are not used to that. We're used to working on the ground, working with people. And I can see how you phrase it in a SMS and all of these things, and especially when it relates to protection, we need to learn there, and we have some catch up to do. So that would be sort of a fourth point, I guess, to those points. Thanks.
Thanks so much. And I might just throw it out to the audience. I know we've got a few minutes left. Are there any thoughts, ideas, challenges to any of the panelists from the room? Johnny?
So, I was intrigued by your thought about professionalizing communication within the agencies, but also recognizing the informal nature of all the communication channels that already exist. And how do you avoid trying to professionalize communication within the communities? You know, if you're professionalizing within the agencies, how do you recognize that the and give credit to the informal nature of communication that already exists?
Good. I think that, and maybe I'm not making myself clear, it's often the case. So I think you can leverage those informal channels without trying to impose upon them. You see what I mean? So when I say professionalize, I mean somebody who draws a poster on PowerPoint at 4 o'clock on a Thursday afternoon because that's what we need is probably not going to do a brilliant job if they haven't got the understanding, the evidence, the having tested it 2 or 3 times, having iterated it with the community, having thought about a strong theory of change that's going to underpin it, thinking about the communication framework which they're working to, thinking about the way that communities perceive language, symbols, colours, personification of people in graphics, in their cultural life, all those things. And I think you can still produce a really great poster, SMS, WhatsApp, audio clip, piece of video for a community worker to have on their phone when they're doing the rounds, even TikTok meme that go out there, whatever it is. I think you can not waste your money producing stuff that's unlikely to work. And you can still then use informal networks to get that out there and use those informal networks to understand what people are thinking and feeling without having to impose your own system on a community. Does that sort of make sense?
Any other thoughts from the room? Pfizer.
Yes, having Henia and you here, specifically around cash or the programming, often it feels like that our services are determined, right? We have to give a cash, and it's the entitlement value is going to be this, and it's made on generalism assumptions around the community. How, in your experience, you have tackled which we call as out of scope or kind of too ambitious or out of our next 6 months of programming decision making? Do you make use of that data, or how does that influence your thinking? Just to learn some examples.
Yeah, so I mean, we often ask what is it that they want, and people often say cash, just as background, and it's actually true. So often we give cash because that we have learned that this is what they prefer, because then they can buy what they want instead of ordering kitchen sets to Ukrainians in Poland, for example. It's not a good example, but it's something that we could do as a UN agency because it's sort of a tradition. We do post-distribution monitoring twice a year. We must be better at using the figures. We have worked on this, for example, with Catherine, we analyzed, so why is it so low that people don't know where to go? Then we analyzed, we took it to the regions, we took it to the countries. People don't know. You need to follow up with your communities and ask them, what is it that they don't know? What is it that they don't understand? You say you have done X, Y, and Z. So we go into analysis in terms of problematic things. If they, for example, say, we prefer in-kind over cash, then we have to shift. And we have done so in settings where this has happened. So it can inform programming, but certainly we don't do it enough. And we need to do it better. And often it's actually at global level. We see all of this and we call the regions call the countries. So, you know, like it's not in their nature in the operations to analyze these figures and change their programming.
For example, jobs comes as a very normal question all the time. And a lot of UN agencies, I mean, I work for World Food Program, but when we post that as in a humanitarian setting, they say it's out of scope. We don't give jobs or we don't know what to do. And we just really don't know where to stage this data collectively at what level? IOM, UNHCR, WFP, where do we take it? And everybody calls it an out of scope cases. And it's always an interesting debate that what is out of scope really? Is it somebody's problem or it's nobody's problem? Or do we have a system to collectively look at all that out of scope data? So any surprises around that, or any example where somebody could have made use of that out of scope kind of things?
Yeah, I'm surprised. I mean, we wouldn't say it's out of scope. I mean, livelihoods for refugees is our key priority. It's often hard because of legal restrictions and also the sheer poverty. So jobs is difficult for everybody. And on top of that, you're a non-national, you may not speak the language and you may not have the right to work. So I'm just trying to understand why we would say it's out of scope, but it's something that we are really, of course, not considering out of scope. But it's a very, very hard nut to crack in many, many countries. No, it is. And we try to give cash for livelihoods, for example, but in the end, sometimes they end up, you know, using the money for food because it's simply not enough. So, I mean, there are lots, I mean, a million challenges there, but it's certainly not out of scope. Yeah.
If I can just come in there quickly, I think it's a really important point. And from our perspective, we have a lot of quite fun but difficult conversations about this because through 10 years now of GTS collecting feedback from communities, this is the number one priority and the number one piece of feedback is, you know, we can comment on the quality of the assistance or the relevancy of it at a certain time or the quantity or whatever it is, but fundamentally, particularly in protracted crises, this is not what we want. We don't want to be recipients of aid and we need other things. And I think that your point is actually really spot on because we have so many conversations with humanitarian country teams where even just innocently trying to share that feedback, we get completely shut down. Like, why are you asking that? You're raising expectations. We're humanitarians. We don't deal with these issues. And I would recommend everyone in this room as a fun exercise to do if you're also in these conversations, to read any humanitarian response plan this year because all of them have, if not all of them, most of them, as probably their number one objective is longer term solutions. And so I think there's a point at which if this whole nexus discussion is going to move beyond just a new nice thing that people are talking about, there has to be a little bit more pressure placed on decision makers and people who are holding the pen on these response plans to say, is this something that we want or not? And if we don't, to stop pretending that we do. And the more that you push back, the more interesting the conversations become, because I think there is a lot of work going on behind the scenes on some of this Nexus programming. And as you said, to you, it's never been considered to be something that's kind of out of scope, but is maybe, you know, factored in a different way. But it's a really important kind of keystone of accountability because this is going to, I think, continue to be a lot of the feedback and the communication that we get. I think we're almost at time. Was there maybe one more question or comment from the room?
Yeah, well, I was just going to make the point related to the information piece that having independent structures and resources that can answer any question that would come through rather than just the questions that are sort of prompted is extremely valuable. And when we talk about accountability or that two-way engagement, how you were saying it's limited to, did you like the service that you got? Yes or no. And it's kind of a limited transaction. When we open those up in most countries, about 90% of the questions that come in have nothing to do with the services that we wanted feedback on. As an agency, we found that consistently at IRC. And so having something that can be cross-cutting, that's sort of independently curated, we find a lot of value in that as our project. And it's really similar to the work that you're doing at BBC Media Action, where it needs to be sector agnostic, agency agnostic, but just sort of broad in general and open, there to actually be an understanding of information needs in a population and to build something with value to a population as well, is that you have a question, you can get an answer to it. And it seems like a really simple thing, but when we talk about information as a human right, it's like it's the right to expression. It's also the right to understand what is going on around you as well. And often we really fail as a community to deliver on that. So I just wanted to appreciate all the comments that were made because really nailing it.
Just a comment from Aline from Save the Children Online. I fully agree with the fact that there's not enough recognition for communicating with communities or AAP more widely. Really recognition that it requires dedicated skill sets. This sentiment, unfortunately, often translates in a lack of resources for such functions. Aline.
A very good point. Or maybe also resources channeled perhaps in the wrong way. Like we had an interesting discussion earlier, and also actually Irene's point about when you say no to funding, we've had experiences of doing that before, and then the funding gets given to some other agency who then sort of uses it in a way that completely undermined the point of the exercise. So I think it sort of ties into some of the bigger, maybe more systemic questions, but very well noted. I think if there's anything that's come out of the discussion from almost everyone is it's this idea that people's lives in emergencies don't exist in a humanitarian vacuum. And I think that was very clear from Henia's points. People's lives don't stop, and some of the issues that sort of underpin more longer term approaches still exist. People have rights in emergencies. People's priorities are not out of scope. And reducing this communication issue to two-way communication or information sharing, or some of the themes that maybe we've put into some of our handbooks just don't go far enough. I think that's a really interesting point actually to stop on, because it brings us back, I think, to more of the big ideas that we had this morning, and how do we actually enable some of this power shifting in a broader sense than just rolling out manuals on how to communicate, what enables that, what are some of the barriers. So hopefully some interesting things to discuss. I think Henia has a final comment.
It's just, I think from my, what I am hearing today, I think one of the things that we could recommend out of this is that this is an area of work that is really need additional resources in order to make it, a standing element of any response. Any response should have a dedicated resources for this area of work. Whether, people want to call it AAP, whether it's AAP and communication and community engagement to and accountability to the community. I think it is very important area of work, and I think it needs dedicated resources for it. And I think unless we make the resources available, in addition, again, I'm not saying it has to be in isolation, but it really, even as sectorial or clusters that work on these elements, they need to have a dedicated people also who work on this element. So I'm not saying that we only have that the issue about resources is only funding and money, but it's also human resources that are trained. I agree with Richard, who basically understand, theory of change. How do we communicate? How do we make that happen? So the more we collectively, and I think it's collective, and I think it's intersectoral and cluster, that really this area of work needs to be more centralized and more actively, actively. I would not want to say the word ensure, because I don't think I definitely we cannot ensure anything. But I think one thing that is very important is to make sure that resources are available to make this happen more systematically and more in a more sort of directive type, although I really hate the word directive, but really making sure that we also engage the community from the get-go in order to understand them better and then find solution collectively. And we might not find the solution, but at least we can respond to some of the needs of the community in a better way and in a quality better way than what we have been doing until now. So from my side, I would say these are like critical in terms of building the trust and the transparency and ensuring ensure aspects, but making this an element of any response. Regardless, big emergency, small emergency, we really need to make this a standing element in any response. Over from my side. Thank you.
Thanks so much. I think while we're just waiting for the coffee to arrive, one final question that hopefully builds on that a little bit is recognising that what we're talking about is a sort of fundamental change in the system, which we can learn a little bit, I think, from cash on. So your point, Henia, about how do we make sure that this is just something that is implied and happens in every response? And, these were conversations in cash that were probably happening, quite a few years ago and have sort of turned a corner. Maybe Annika, just to wrap up, from your experience as someone working on a thematic area that has sort of demonstrated some systemic change, what could we learn as communicators on how to help to take this to the next level that it needs to go to?
Well, it requires institutional change across the board, and that requires a lot. It requires senior management attention and awareness and, seriousness. It requires a huge amount of resources and the right resources. It requires a lot of investment in country operations, which we often sort of oversee. The capacity building is massive. We train some 10,000 people in UNHCR and partners on cash. It wouldn't happen if we didn't train them. So, I don't know how many we have trained in UNHCR on this, but Catherine may, but very far from 10,000 people, right? So, it is a lot of things that we did to achieve institutional change. And believe me, we are not 100% there either, but we are well ahead. But what we learned is also the senior management, very high up. It needs to buy in and really push it out in an organization like the UN. And I guess I can speak for all the UN agencies here. So I think those are some of the things that we did. Also, of course, the systems need to be changed to reflect the needs of communication. They probably aren't fully in UNHCR. Tools and guidance is probably there. There are many elements. If you look at all the things that you need to have, there are very many. And of course, the partnerships, and everybody needs to then do this. It's not just one agency. And so I think a lot of learning is there. And I think one reflection on the previous question is actually, with the risk of Catherine never speaking to me again, I would say we also have to aspire for good enough, right? And I'm saying that because of my experience of getting a loan. Like, it's not perfect. I don't know who to call. I don't know. I have to find the information. Sometimes tough luck, right? We need to invest, but we can't aspire to this perfect world because nobody is in there, right? So sort of, yeah. Thanks.
Can I do 30 seconds on that?
Yeah,
I think a key difference between what's happened in cash and what we tend to talk about, is that I can explain the cash change to a non-humanitarian in one sentence and they get it. Instead of giving people buckets, we're going to give them money and then they can buy whatever they want. Makes sense. It's obvious when you think about it, right? I don't think we have that one line, or if we did, we've lost it because we've got stuck in the quagmire of all sorts of things that we keep talking about. So I wonder whether if we want to achieve it, it also needs to be something that we can explain in a sentence what it is that we're seeking to do.
Rosie has said, and incentives for those who can't hear. I can't believe that the elevator pitch of AAP or CCE or CCEA is not convincing. I'm horrified. I think you need to get your messages down. On that rather cheeky note, sorry. Thank you so much to the panelists, to Henia, who I think has joined quite early now that I think about it, in New York. Thanks so much. Thank you to both of you and to everyone in the room for the engagement.